There is no cure for Lewy body dementia, but several treatments can help manage symptoms. However, treatment requires careful balancing, and people with Lewy body dementia are extremely sensitive to certain medications that could be dangerous. So let's start with thinking in memory. We're going to review medications we've covered already are acetylcholinesterase inhibitors, mainly donepezil and rivastigmine. Galantamine, less so commonly prescribed. These medications can improve attention, reduce fluctuations, and help with hallucinations and other behavioral symptoms. Unlike in Alzheimer's disease, these medications may have an even greater benefit in Lewy body dementia because the cholinergic system is more severely affected. Memantine may provide additional benefit, though evidence on this is mixed. Important note, even if these medications don't seem to produce obvious improvement, they may be slowing decline. Stopping them can lead to worsening of symptoms. Don't discontinue any of them without discussing this with your doctor first. So for movement problems, carbidopa-levodopa, or Sinemet, the main Parkinson's medication, can help with stiffness and slowness, but must be used carefully as it can worsen hallucinations and confusion. For hallucinations and behavioral symptoms, acetylcholinesterase inhibitors help with reducing hallucinations. If hallucinations aren't distressing to your loved one, they may not need specific treatment for this. But here's the critical warning. Antipsychotic medications must be used with extreme caution. Meds such as haloperidol, risperidone, olanzapine can cause severe rigidity, confusion, falls, and even death. This sensitivity to antipsychotics is one of the most critical things for caregivers to communicate to all healthcare providers, especially in emergency situations. For REM sleep behavior disorder, melatonin is often tried first and can be effective. Clonazepam at low doses can help, though it carries risks of sedation and falls. Safety measures are important. Remove sharp objects from the bedroom, pad the floor around the bed, and consider separate beds if the partner in bed is at risk of injury. For autonomic symptoms, orthostatic hypotension is common in Lewy body dementia. This is when blood pressure drops upon standing. Increase fluid intake and salt intake, wear compression stockings, and rise slowly from a sitting or lying down position. Medications like fludrocortisone or midodrine may need to be prescribed. Constipation, fiber, fluids, stool softeners, and laxatives as needed. Another critical safety warning, medications containing anticholinergic effects. So think over-the-counter sleep aids, allergy medications like Benadryl, bladder medications can worsen confusion dramatically. Always inform all healthcare providers and think ER rooms, specialists, surgeons, even dentists that your loved one has Lewy body dementia before any new medication is prescribed. Keep a medication list handy for any and all medical appointments. Hi, I'm Ashley, a nurse patient advocate with caregiver support and resources. Give us a follow for dementia education and caregiver tips.